Hey, what's up, guys? I'm about 9 weeks into taking HGH and wanted to give an update on some things that I've done that I've kind of changed, I tweaked in my daily routine of taking it, and I think it worked for me as far as eliminating some of the side effects that I was getting. When I first started doing HGH, I learned that you take it for 5 days and then you take like a 2 day break in the week. And then I've heard some people just say they just take 1 day. And then I heard by two supposed to be credible doctors online that you're supposed to take it every day. Now, were they saying for like somebody who's doing bodybuilding and maybe only take it for 6 weeks or therapeutically? I don't know, but I started taking it every day, and obviously I got really great effects, and I think that accelerated, like taking it every day, really accelerated the benefits of it. But then eventually I came to a point about 2 weeks ago where I think it was like starting to make me a little sick. It was like weighing down on me, and I was getting a lot of like in the morning, like fluid buildup, like coughing shit up, blowing my nose, like excess mucus, and it was affecting my voice even. Like, you know, when you like you can't talk because it's like something, phlegm that's always in there. Like it was consistently like that. I'm in school trying to talk to people. It was kind of embarrassing. It was like coughing up shit all the time like that. And I looked online, and sure enough, that is a side effect. Voice changes and things like sore throat, things like that. So, and I was getting sore throat in the mornings as well. The other thing is the tingling of the fingers, which is related to the carpal tunnel, which is a very common side effects. So I was getting that too, especially in the morning or when I was laying down. And maybe there's a slight compression of the nerve or like the fluid buildup in like the median nerve, tingling of the fingers. And anyway, so in the last week, 2 weeks, I've just been doing it weekdays, then take weekends off. Still doing the same amount per day, which is 0.75 I use in the morning and 1.5 at night. So in total, that's, I can't do some math right now, 1.75. It's 1.75 plus like actually it's more like zero point 0.8. So I don't know. It's approaching 3. I use a day. 2.5 to 3. Sometimes I take a little more. Sometimes I take a little less. So 2.5 to 3, I'll say. But doing it, taking those 2 days off, I'm not getting any side effects anymore. So I think it's a good thing to do to kind of let, like, almost like breathe, like let your body kind of recover a little bit from it and then go back into it. Although maybe then you're kind of eliminating the benefits. Maybe there's a bit of a trade-off there. Or maybe you're letting your kind of all your HGH receptors or IGF receptors kind of like recover, and then maybe they're able to use HGH more effectively. I don't know. All I know is the side effects were really starting to weigh down on me for a while there, for like 2 weeks. And it was making me kind of sick, I think. So, yeah, that's my advice. The benefits of it, though, are still there, and it's still good. Now, I looked the other day when I first started taking it. I took my shirt off, like my first video. You can check that out. And I kind of compared myself to that. Yeah, there's a bit more to my frame. Okay, like I can see that my frame is just like a bit fuller and thicker, and obviously that's something that was expected in taking the amount that I'm taking and working out as extensive as I do. And second of all, my recovery is fucking awesome. Like before, when I did a leg day, I couldn't sit on the toilet for like 3 days. Now I can do like, I've done like multiple leg days in a row sometimes. And my legs are just, my quads are, and my hamstrings are popping more than I've ever seen them before. So it's that, but nothing that's too crazy. It's not like, I wouldn't imagine it's like a steroid cycle at all. I'm not getting like massively ripped, but there's a fullness there, and and more of a hardness, I would say. And like even like my wrist muscles are like popping maybe a little bit more than I've ever seen them do before. You know what I mean? The flexors and extensors and things like that. Just like little things. Nothing too crazy though. It's not like I'm fucking filling out like crazy. But the the main reason why I was taking it, and if you watch my other videos, you would have heard me say this, is because of like osteoarthritis issues and menisci issues, which is like essentially the cushioning between your knees, on the medial side, which is the most common. And I injured that snowboarding years ago, and it's just been giving me issues when I do squats. Like I couldn't squat properly. I just gave up squats for a while. Now I can do squats, which is pretty good, right? And the right ankle, that was osteoarthritis. It was just essentially bone on bone. There was no more cartilage left. Like it was just, that injury was from like when I was like 22, so that would have been like 16 years ago, roughly. Yeah, I just like destroyed my ankle. My ankle was like turned backwards and was totally fucked, like sideways back. I just twisted it and like landed 10 feet pretty much on it, skateboarding up a huge ramp. Tried to do like a 180 and just got twisted in the air and just landed like on my foot, like underneath me. It just went, it was like totally backwards. It was just like, here's normal feet. It was just like this. So after surgery and after walking, I was even walking for a cane for like a few months from that. Yeah, it left me with serious degenerative kind of joint issues there. And now I would say and I was in constant pain. Like if I was to go skateboard or snowboard even, or like do something active, like go for a run, I'd be feeling it especially the next day, or like even right after. There'd be inflammation because with osteoarthritis, there's a constant kind of grind that happens. It's a constant, you're just wear and tear. It just keeps continuous, right? Because there's the normal joint cushioning is not there. So now though, I feel like it's a lot better. I really don't even pay attention to it. There's no pain to it. It's really quite amazing, actually. And I'm wondering if the HGH kind of helps with just general like inflammation too. I don't know, but I could see that for some tissues, and I could see that maybe it kind of like helps the whole metabolism of things. It just helps process maybe things like acid buildup, like and stress hormones and things like cortisol, things like that. I'm thinking, this is just me going on, maybe I'm going to verify this maybe after. But here, let's just do it right now. I'm pretty sure it does, because there's no other way in the explanation. Does HGH eliminate cortisol levels? Suppression of cortisol secretion. Treatment with HGH did not alter the peripheral metabolism of cortisol as measured. HGH therapy and hypertrophy associated with an apparent reduction in availability of administered. So it's not very clear. Does HGH lower cortisol layers? Reduces circulating. Yeah, it does. Growth hormone treatment in hypopituitary GH deficient adults reduces circulating cortisol levels during hydrocortisone replacement therapy. Now that seems like it's a specific example, but nonetheless, my inclination is it does, and it helps with something with the stress hormones in the body and process that. The other thing is my sleep is very good as well. Normally I had some sleep issues. I really have not had any sleep issues. I wake up refreshed, going to school every day, and overall sense of well-being is a little bit better too, I think, than what I was before. It's not that I was a necessarily depressed person, but it was like, you know what I mean? I just don't feel any anxiety about things. Maybe there's something to that. Maybe it has something to do with these like hormone levels, the cortisol or something else levels that would be in the body. Maybe there's a regulation there. I'm going on a limb, like with what ifs. Like this is not my expertise. I'm just stating everything that I've experienced, and I think there is some validity to it from my basic understanding. But to get back into the main reason why I'm taking it, and why one of the main reasons why other people take it for therapeutic use, but as well, I'm borderline therapeutic use and athletic use, kind of in between. And I'm not a huge guy, but I'm like over 200 pounds. So maybe like the level I'm taking it, you know, based on body weight, maybe if you're only like 160 pounds, you're not going to take as much as I am, or maybe you do. I don't know. It's up to you. But like I found like with the amount I'm taking it now, and then eliminating it for like 2 days of the week, just taking 5 days a week. Now it's working, no side effects, and getting the benefits. So that's what I'll continue to do. Anyway, if you have any comments, questions, or anything you'd like to add, please leave in the comments section below. Okay? Thanks for watching, guys. Peace.